to be innovative, to be improvement-oriented, to be inventive, depends on having a set of skills. And those skills, they can be taught, they can be learned, they can be practiced, and they can be mastered. And as they're practiced and as they're mastered, they can be applied with great, great effect. Great effect. Now you'll be also saying, wait a second. I'm in the healthcare professions after all. We're already inventive. We're already innovative. Look at all the great science we develop. Look at all the great technology we develop. Not denying that. The improvement, the invention, the innovation we're talking about is not in the science and technology of medicine. It's in the science of systems. How you pull all the disciplines, all the functions, all the specialties that go into providing care to patients. How do you pull those together so when they come together with great harmony. When they come together with great choreography. When they come together able to deliver tremendous value to the patients who depend upon you. Now you might be saying, wait a second here. I'm not responsible for systems. I'm doing the direct care of patients, providing care to patients because I'm a nurse in a unit, I'm a nurse on a floor, I'm a doctor in a practice. Well, you still have to think about systems because you're embedded in a system. And if you're embedded in a system, it means that every day you're encountering problems. The things you need to fully express your medical training, they're not available. You're missing information. It's inaccurate. It's not clear. Materials and supplies you need to do your work, they're unavailable. You can't find them. You have to track them down. Constantly you're encountering these impediments, these obstacles to being excellent. And you may be saying, well, after all, that's just a normal part of healthcare. And the assertion here, it's not. Those are solvable problems if you know the basic science of systems, if you can converse with your colleagues, collaborate with your colleagues using this basic science to clear up the problems that affect all of you. So that's for those of you who say, well, I'm just embedded in a system. But then there's the rest of you who today or someday will be responsible for the work of others. And knowing this basic science of systems will make you far more effective in supporting other people as they provide the direct care to patients. So that's the basic theme. Excellence is possible. In order to achieve excellence, innovation is necessary, not a choice. But the good news is, it's not just inspiration upon which you depend, it's actually a set of skills.